maintaining a policy-free option in the state health plan, and I'm not referring to the consumer-driven health plan, I'm referring to one of the PPO options, as one of its top 10, and that ranks number 5. So it is very high in importance to our plan members. Now, over the course of several meetings, you've talked about member engagement, and especially regarding wellness and how we help to encourage members to get involved in their wellness. I would suggest to you that the benefit structure is currently being proposed to you does provide for engagement, but it's generally of a coercive, involuntary type, not the voluntary type that we need to have in order to get member commitment and buy-in to what you want to achieve. Now, among some of the problems I see with the proposed benefit design you're having. Number one, it fails to address 2 of the primary failures and deficiencies in the state health plan. One, underfunding. And secondly, the cost of dependent premiums for state employees, retirees, and for teachers. Secondly, it increases cost shifting, and you've heard that from your staff. It outpaces the pay raises of the past 6 years, as Mark has noted. It minimizes the adverse impacts of consumer-driven health plans, and literature and research will show that there are problems there. You've seen and heard the positive, but I would caution that there are problems. And it does, obviously, and Mona's mentioned this, it reduces the viable choices. You are eliminating and minimizing the choices that are ultimately available to your employees. Now, underfunding and dependent premiums. The 2010 Legislative Blue Ribbon Study Commission on the State Health Plan showed that North Carolina is spending less per member per month than other states on their state health plan products. Secondly, Kaiser Foundation reports that large employer group plans normally pay 72% of family premiums. In North Carolina, because we do nothing for a direct dependent subsidy, and you've had discussions on that, our employees are paying over half. They're paying 52% of the total premium. So again, that gets back to the underfunding. The recent state health plan comparative study, Tom reported to you that when it comes to dependent coverage, we rank basically dead last. So again, we need to look at what is being done to resolve that situation. This does make the state non-competitive with regard to how we compete with other states and with other large private employers. Now, SEANC, and time doesn't permit, we have presented to this board proposals, including one on how to save as much as $350 to $400 million per year. That savings could be used to eliminate your premium surcharges, to help provide subsidies, direct subsidies for dependent premiums, and to reduce the out-of-pocket costs for plan members. I'd be glad to come back at a future meeting and discuss those with you. But here's some recommendations I hope you will take into account. Number one, please do maintain a premium-free PPO 70/30 option. Please look at eliminating or reducing premium surcharges. And please reduce the generic drug copays, especially the proposed changes in the PPO 70/30. Finally, ask the General Assembly to appropriate funds to provide at least a 50% subsidy for dependent premium to make the state health plan affordable, not just for the state health plan, but for the members who are in that plan. And I've heard no discussion of that, and I see no proposal before you that makes it affordable for people that need to insure their dependents. Link employee cost sharing to pay raises, so that when state employees get a pay raise, that's when maybe you look at increased cost sharing. But without that, you're going to continue to see the costs being shifted to state employees. And finally, look at linking this to the Affordable Care Act, because currently dependents of state employees do not qualify for the premium tax credits in the health benefit exchange. So ask your congressional delegation, have this board go on record as supporting a change to the Affordable Care Act so that dependents who cannot afford it through the state health plan can get the premium tax credits through the Affordable Care Act. Madam Chair, I do thank you, and certainly I thank all the members of the board for your time and consideration of these issues.